wabarakatuh. Good evening, Professor, Doctor, and Senior. Thank you for the opportunity for me to present my final paper with the title is Structural Quality Comparison of the Hydroxyapatite synthesized from porous clam cell waste and porous egg cell waste and compared to the commercial synthetic hydroxyapatite pongros as a bone substitute. For introduction, from the experiment at the United States, the non-union fracture, the incidence of the non-union fracture is 5% until 10%, and it's growing rapidly. And then for the optional treatment for this non-union fracture for now on is the first, the bone morphogenetic protein and the blood-rich plasma and low-intensity pulse ultrasound and autologous bone grafting, heterologous bone grafting, and the use of the bone matrix. One of the treatment is the with synthetic biomaterial hydroxyapatite. And then because it has a characteristic stoichiometry and the higher ratio between calcium and phosphate, but it is too expensive for the patient. So the methods of this experiment is for the objective is to evaluate the quality of hydroxyapatite which contained in the waste of anaerobic granulosa compared with waste of eggshell and the commercial synthetic of hydroxyapatite, which is pongros. For the experimental GSW and the 9X cell waste or ESW and the 9 control group is the pongros. And the location is at the Medical Faculty of Gajah Mada University, which take place at the October until November 2021. For the sample study, we do the purposive sampling with the Federer's formula. So the method, the clam cell waste and derived hydroxyapatite and the egg cell waste derived hydroxyapatite, the GSV and ASV are washed and dried. The powder was sieved. The powder was heated in the 900 degrees Celsius during 4 hours and mixed with 0.5 ml in the diammonium hydrogen phosphate and heat in 400 degrees Celsius and mixed with the sugar with the ratio 1 and compacted mechanically. And then we do the analyze the structure and morphology using the SAM electric microscope. So the quality testing is evaluated using the same SAM XRD with the gel tape JSM 6360LA and the statistical analytic with the several wheel test and the Kruskal-Wallis significance or the NFA test. So this is the result for the microscopic, the particle size of the HIP or the clam cell waste, and then the figure 1 and the egg cell waste is happy is the figure 2 is smaller than the control group of figure 3. And then the calcium and phosphate level, calcium level was not significantly different, and the P level, so it's also not significantly different between the egg cell waste and then the clam cell waste, and the control is a pongros. For the area, volume, and surface, the pore area in AVHIP and the GVHIP is smaller than in pongros for the control group. This is the result for the figure 1, the spectrograph and the morphological structure of CVHIP at the 40, 1000, and 5000 magnification. The figure 2 is from the axial waste hydroxyapatite. And then the figure 3 is the control of the experiment with the pongros at the 40, 1000, and 5000 magnification. For the result, this is the pore area, pore volume, and the pore surface area in 3 of the experiment, the EVHIP and CWHIP and the control group of the pongros. We can see there's no significant difference between. For this discussion, result, there are no significant difference in the calcium and phosphate content between clam cell waste hydroxyapatite and egg cell waste hydroxyapatite and the control group. And from the other experiment, there's Sakti and Magatsari, there's a relationship between the histological structure and the result of the X-ray diffractometer of the egg cell structure with the synthetic hydroxyapatite graph, which is pongros. From the Sari and Kurniawan proved that the presence of the bone formation with the use of anaerobic granulosa as graft substitute bone. So this is a hydroxyapatite itself, chemically and physically a same mineral content, 95% until 99% aziotica, 1 until 5% organic macromolecules, and synthesized from calcium oxide as a raw material. For the hydroxyapatite layer, there is a 3-rail, the aragonite layer, and then a hedge for bone, and this study categorized as a porous hydroxyapatite. For the structural match, hydroxyapatite and the formation of porous hydroxyapatite obtained from shell and from egg cell, which is synthetic hydroxyapatite, which is commonly used today. Which is bone rust. The egg cell hydroxyapatite is with a high bioavailability and a low toxicity. And from this study, there is no experiment have been carried on test animal for the hydroxyapatite on the clam cell waste. This is the function of the hydroxyapatite itself, the bone scaffold. And then for the hydroxyapatite calcium phosphate, lack of tensile and torsional strength, fundamental implant can inhibit markers of bone formation, stimulate bone loss or resorption, and show poor osseointegration, release toxic ions. For the adequate size of the hydroxyapatite itself is a 150 nanometer from 100 meters, and the 100 and 400 meters the most appropriate practical size. It is too small, can be absorbed too quickly, and if too large, it's inhibited vascularization and can't be isolated. So from the anaerobic granulocyte itself, there is calcium carbonate that is increasing the production of the BMP osteoconducting properties. There's a biocompatible, osteoconductive, and biodegradable. And then is the osteoconducting properties is reduce the inflammatory process and the forming the granulation tissue. Conclusion, there's a structural hydroxyapatite and the formation of the porous hydroxyapatite obtained from the clamshell and from egg cell with the synthetic hydroxyapatite from the bone rust. The control sample of bone rust had a better structure as a bone scaffold component, but the structure of the egg cell and the clam cell already met the criteria as a bone scaffold component. The shellfish and the eggshell can be an alternative source of the hydroxyapatite substitution. That's all from my presentation, from my final paper. Thank you for the opportunity.